in a few seconds.
Want to start the webinar? Welcome, everyone. We'll just give a few seconds for everyone to join. Good morning, good afternoon, and good evening to everyone. We welcome you all, particularly those of you joining from far away or from late or early times. Thank you for joining. Thank you for joining us today for a very special webinar. It's on a fragile state of preparedness 2023, the Global Preparedness Monitoring Board report. And we have with us Dr. Sylvie Briand, who you are already very familiar with, those of you who follow EPI-WIN regularly, and she will be the moderator. But before I hand over to her, I'd like to add, for those of you who are new to EPI-WIN, that this is the WHO Information Network for Epidemics for Science and Knowledge Translation in Health Emergencies. With these EPI-WIN webinars and the associated EPI-WIN digests, our goal is to translate science to make it accessible, understandable, and relevant for evidence-informed actions and decisions in health emergency preparedness and response. We have a very eminent set of panelists today. So without further ado, I hand over to Dr. Sylvie Briand, who's now Executive Head of the Global Preparedness Monitoring Board Secretariat, to introduce the eminent speakers and provide the introductory remarks. So over to you, Sylvie.
Thank you very much, Supriya. And thank you for highlighting the change in my position. And it's really an honor for me now to be appointed to serve the Secretariat of this GPMB. To introduce this session, I just would like to highlight that we all know that we will have other pandemics. It's inevitable, but the timing remains uncertain. And the occurrence of a pandemic depends on various interconnected factors, making it challenging to predict when these factors will align and lead to a pandemic event. So we know that pandemic preparedness is important. Firstly, pandemic preparedness is more cost-effective than pandemic response. And secondly, we have seen throughout COVID-19 pandemic that countries prepared for respiratory pathogen events, demonstrating the ability to mitigate not only the health impact, but also the social and economic consequences of the pandemic. So pandemic preparedness is a must if we want a safer world. So today, we will talk about what is new about pandemic preparedness. And we will take the opportunity of the recent publication of the report of the Global Pandemic Preparedness Board, GPMB, to highlight some of the new features of the pandemic preparedness. We are honored and privileged to have today a panel of distinguished speakers, and I thank them for making the time from their very busy agenda to contribute to this discussion. We have Joy Fumafi, who is the former Minister of Health of Botswana, and she is the co-chair of GPMB. We have also Victor Traut, who is a member of the GPMB and also the president of the National Academy of Medicine in the US. And we have Scott Pendergast, who is the Director of Strategic Planning and Partnership in the WHO Emergency Program, and has led the development of a number of elements of the HEPR, which is a Health Emergency Preparedness and Response Architecture. And this includes, of course, the Pandemic Fund. So before starting the discussion, I will give the floor to Amélie Rioux from the GPMB Secretariat to introduce the topic with a short presentation. Amélie, the floor is yours.
Thank you, Supriya. Thank you so much, Sylvie. Good afternoon from Geneva, everyone. We're so delighted that all of you could join us today. So I'm very happy to take you through the Global Preparedness Monitoring Board's 2023 report on the state of the world's preparedness, which was published on 30 October. However, first, let me just give you a quick introduction to the Global Preparedness Monitoring Board, which we refer to as the GPMB. So next slide. So the GPMB was co-convened in 2018 by the WHO Director General, Dr. Tedros, and the President of the World Bank at the time, Dr. Jim Kim. In the wake of the Ebola outbreaks, they decided to establish a platform to monitor the state of the world's preparedness, identify gaps and actions needed to address those gaps, and to advocate for action. And that was in order to break the cycle of panic and neglect that had prevented us from being better prepared to address Ebola and other health emergencies. So you can see on this slide the membership of GPMB. So the co-chairs are Joy Fumafi, who's with us today, and Kalinda Grabar-Kitarovic, who's the former president of Croatia. Board members include also several well-known former policymakers, diplomats, and other senior health leaders with expertise including economics, law, veterinary sciences, environment, gender, R&D, global health, and development. Next slide. So this 2023 report is actually the first report that the board has based on its monitoring framework for preparedness. So the monitoring framework is actually a framework of indicators that provides a risk-based, multi-sectoral, whole of government, whole of society assessment of global pandemic risks, of global health emergency, prevention, preparedness, and response, and of the global impacts of health emergencies. So this year, of the 90 indicators that are included in the framework, the board assessed 30, which describe the current state of preparedness through the lens of equity, leadership, and accountability, and coherence. So next slide. So you'll see here the heat map of the assessment included in the 2023 report. So each indicator area has been scored, so first through expert assessment and then by the board itself. The assessment considers two elements for each indicator. So first, it looks at whether capacity is fully in place. So based on a score of 0 to 3, where 3 is actually colored green, which you can see there, which means the capacity is fully met. Second, the assessment considers also whether preparedness in that area has improved, whether it has declined, or whether it's remained the same in the past year. So you can see on our heat map here that there's no green. So the board didn't assess any single capacity as fully met this year, which is obviously very disappointing. You'll notice also a balance of up and down arrows around the wheel. Some areas have continued to improve due to COVID-19 efforts. However, others have been declining following the end of the pandemic. There are some areas of encouraging progress, including efforts to adopt the WHO pandemic agreement, community engagement, and regional laboratory capacity. But there are also areas of decline that are a big concern for the board, including the failure of preparedness financing to increase to meet the needs that were identified since COVID-19, and the failure to integrate independent monitoring into reforms. The board has called this canary in the coal mine issues because we see this as the earliest signs of more systemic problems. And that's because without concrete commitments to financing and monitoring, preparedness capacities are likely to regress over the coming years, and we'll see more red on the heat map. So next slide, please. So here you see the 4 recommendations made by the board in this year's report. So these areas were prioritized based on the findings of the assessment, and these are areas where the board felt more urgent action was needed. The 4 areas, so the 4 recommendations are focused on strengthening monitoring and accountability, strengthening the global financing system for pandemic prevention, preparedness, and response, establishing regional capabilities for R&D and supply chains, and developing a new approach to multi-sectoral, multi-stakeholder engagement. Joy and Victor will be able to share more details on the recommendation. I'm happy after to answer any questions you have on the report. Thank you so much for your participation today, and I'll turn back to Sylvie.
Thank you very much, Amélie, for being so concise, but at the same time, it's very informative. And I hope that everybody who has joined the call and will be willing to read the report after this call. And we will take advantage of Joy Fumafi and Victor Tsau's presence to really deep dive a little bit more into those recommendations and give more details on those recommendations and the approach. So let me first start by inviting Joy to answer the following question. Amélie has talked a lot about the framework, but I just showed the heat map and how it was built and how this informed, in fact, the deliberation of the GPMB. But could you tell us what sets this framework apart and makes it special and innovative? Thank you, Joy.
Thank you a lot, Sylvie, and hello to everybody, and thank you so much for joining us. The GPMB Monitoring Framework is a framework, like Amélie said, of 90 indicators. What makes it unique is that it provides a risk-based, multi-sectoral, whole of government, whole of society assessment of the global pandemic risks of global health emergency prevention, preparedness, resilient capacities, and of the global impact of health emergencies. So it is a comprehensive tool, but it has also been developed with a multi-sectoral lens. It is a evidence-based, and so it will help us to prevent, to mitigate, and to respond much more effectively than we're able to during the COVID-19 pandemic. So we see it as key to helping countries, to helping institutions, and to helping communities to assess the risks and to track their own capacities to respond. So it is a tool that we feel will help them to prioritize actions and ensure that investments are targeted and effective. And it is also a tool that will help to empower them, the countries, the stakeholders, to prepare themselves better. So we have 3 goals with this framework: to provide a diagnostic tool to better understand global levels of preparedness. It is also a learning tool to share lessons, between stakeholders, between countries. And it is also a tool to improve accountability for commitments made. We also want to provide a more accurate picture of preparedness based on better understanding of the risks and the actions needed to mitigate those risks. So the framework is comprehensive. Its 90 indicators were developed by multi-sectoral experts encompassing human health, encompassing different sectors, One Health, trade, education. It includes supply chain issues. It reviews the state of preparedness at global, regional, and country levels. It is dynamic, allowing for assessment of trends for each indicator. As Amélie has just said, it emphasizes continuous improvement in preparedness. It also monitors different capabilities, such as effectiveness, such as equity, such as sustainability. The framework is evidence-based. Extensive multi-sectoral expert consultations were conducted. So it relies on data collected across all these different sectors, different organizations, stakeholders, whether it is health-related like WHO and its partners, whether it is One Health partners, multi-directors, even R&D institutions, trade, social protection. So you will note that the first recommendation in our report, and probably our most important, is on strengthening the monitoring and the accountability, because we feel that this is the most important part. So we call for strengthening of the systems for monitoring and accountability at all 3 levels. First, by improving the national monitoring itself of pandemic prevention, preparedness, and response. Second, by investing in data and evidence collection. And then third, by strengthening global, multi-sectoral, and independent monitoring. We have called for the integration of monitoring mechanisms. This would help countries track their progress with the implementation of the agreement, that is the pandemic agreement, and ensure that all countries and stakeholders are adequately supported. The second element of our recommendation concerns the quality of the data. Through the implementation of our monitoring framework, we have identified important knowledge gaps. For example, how many vaccines could we produce in the event of another pandemic? Would it be sufficient to vaccinate the world? This capacity that we have, will there be equity? How much money are we spending on this, on the R&D and development of this capacity? And how effective is this spending? We are concerned that we have major blind spots in our understanding of prevention and preparedness because we haven't invested enough in data collection capacities at all levels, starting from community level. Until we build better data collection capacity, we won't know how to target our investments in pandemic prevention preparedness. Lastly, we have called for strengthening global multi-sectoral independent monitoring. By independent, we mean it must be objective, we mean it must be transparent, impartial, it must be evidence-based and science-based with expert assessments of the pandemic prevention, preparedness, and response. We believe that global expert-driven monitoring can be key in raising awareness and driving action. Monitoring is often associated with punishment or blame, as you are all aware of what happened during COVID-19. But we believe that well-designed monitoring should and can support national and partner action plans and priorities, and actually empower countries and partners to better protect themselves and the rest of the global community. Thank you so much, Sylvie, and I apologize for the long response.
No. Thank you very much, Joy. Don't apologize at all. I think it's very important to highlight the innovation behind this global monitoring framework, which is the first of its kind, actually, and also thanking the GPMB to drive this change and this innovation, because it will make the difference for us all in the near future. And as I can't remember who said that, but what gets measured gets done. And I think this is what we need, because otherwise we can easily fall in this cycle of panic and neglect, which has been the case in the previous decades, where after each crisis, we say never again. And unfortunately, everybody drops the ball and stop really making effort to get better prepared. So this framework can really make a huge difference. And thank you also for highlighting the importance of good data behind those framework, because this is also what will help us to better find the gaps, but also the directions to go to improve preparedness. And as you rightly said, and with a lot of detail, which is really useful, I'm sure for the audience, is that this tool is at the same time a compass and a radar. It's a radar because it will highlight the gaps and where we need to strengthen efforts, but also a compass because it will tell us where to go if we want, for example, to address inequities or more coherence in the system. So I think you brilliantly exposed what is this fantastic new tool that the global health community has for the future. I would like now to dive a little bit more into this report and give the floor to Victor to talk about, actually it's a recommendation 3, I think, about the importance of research and development in pandemic preparedness. And in your opinion, what research and innovation have stood out during the COVID-19 pandemic, and where can improvements be made on the R&D front? Over to you.
Thank you so much, Sylvie. And good morning, good afternoon, and good evening to all of you. You know, to me, it's a great privilege to serve on GPMB and to, of course, work with John Pomafi and Belinda Graber, Kotoracic, and all our colleagues, and especially you, Sylvie, who's joined us now as Executive Director. You know, I've been involved with GPMB from the very beginning, and the concept emerged after Ebola. And of course, the idea between Tedros and Jim Kim say we need a monitoring board, and I'm so glad that we have been in existence. And as you can see, you heard from Joy, the indicators, the monitoring, which is so important in going to future. As Sylvie said, you can't improve what you don't measure. So it's really important to know where we are. Now, so I'm a scientist, a clinician, but also a policymaker. And of course, COVID-19 has taught me many lessons. And I've been very privileged to be involved with. I think I got translation same time I can hear myself. Yes, thank you. Yes. I wonder if there's any way to mute the translation because I have an echo on this. All right. So the point about innovation, I do think that COVID-19 signifies a very important moment for science because we all celebrate the science, many years of investment in science and quickly deploying science to come up with really major efforts and countermeasures such as diagnostic, therapeutics, and vaccine. I think we all know that vaccines were developed record time. It took 362 days from the release of the genetic information to, in fact, authorization of a safe active vaccine. That's unheard of. As many of you know, it takes 7 or even 14 years before one gets a vaccine fully developed all the way to delivery. So I think this is certainly demonstration that science can be extremely effective and useful during the time of crisis, in this case, particular pandemic. But it's not only vaccine. We saw the repurposing of dexamethasone. We saw the approval and development of monoclonal antibodies, antivirals, PCR for diagnostics, rapid antigen testing, antibody testing, and of course, very importantly, oxygen and PPE. So during COVID-19, I do think we should celebrate the science, although it could always be faster and better. I think it's been quite an impressive accomplishment. Now, when you ask me about what improvements, I think about 3 areas: speed, coordination, and equity. We learned a lot during COVID-19 on these issues. For example, there was no effective global system for coordination of pandemic R&D and medical countermeasures. And of course, we may talk about this later, the informal mechanism of the Accelerator Act A, the access to COVID-19 tools, was a good mechanism, but not sufficient because we recognize one is the coordination is informal and therefore it's not so strategic. Secondly, low and middle income countries are not adequately represented in decision-making and coordination. You know, when we look at financing, you'll hear from Scott later on, you know, itself, the amount of R&D that's been spent on COVID-19 is a record high, amounting to $1.7 trillion US. But it's highly concentrated in 10 countries, and rich countries account for 10%, 80% of the spending. So once again, we find that low and middle income countries do not have any financing support in this area. And funding is very siloed, therefore, in particular in high-income countries. And so, of course, delivery, manufacturing continues to be a problem. So there are all these areas that can be improved. What we learned from this and from GPM recommendation is that we need to build capacity in low and middle income countries, you know, and we also need to strengthen regional expertise, ability, workforce. This is probably the most important thing to counter the unbalanced concentration of resources and, of course, of innovation. So GPMB recommends that all regions at a minimum should have the following capabilities: basic manufacturing capacities, pandemic-related products such as vaccines, therapeutics, diagnostic, and oxygen, early detection and surveillance systems and laboratories, and capabilities to collect, as Joy said, and analyze data before, during, and after health emergencies. And of course, importantly, is an agile stock management. When we look at this, all this regional capacity building and approach can be reinforced by embedding a strong and effective global R&D framework in the WHO Pandemic Agreement, which, as you know, is being worked on at this point. We at GPMB also recommend that WHO adopts a roadmap to operationalize this framework when it's done, and of course, publish an updated list of R&D blueprint priority pathogens. Now, there's a lot more, because as I said, speed is important. I addressed the issue of equity already and coordination. So I am the chair of the Science Technology Expert Group of the 100-Day Mission. Our idea is to see, can we actually have, from the day of declaration of an emergency to 100 days, vaccines, diagnostic, and therapeutics ready. Now you can say, wow, this is quite amazing. But picture the following. If you look at the number of the deaths that's related in April 2020, when this is all started, there's about 2 million deaths. But if you wait 300 days later, the amount of deaths was about 40 million. So you can imagine the lives that can be saved if you speed it up to 100 days. So we are looking at how to speed up to have better coordination and to have better R&D and have better public-private partnership. But importantly is a global clinical trials network, working with all of you to all be ready in pre-arranged protocols and network to enroll patients very quickly, pre-positioned protocols. Also, of course, importantly is a regulatory framework of harmonization, whereby it can quickly approve or pre-qualified products that can be used. Finally is regional manufacturing. We recognize that manufacturing occurs in rich countries and only so many sites. That's important to have the capacity to manufacturing in different regions. And I co-chair the Working Forum on Regional Vaccine Manufacturing Collaborative, which we're working very hard. The good news, of course, is Africa, PAVM, PAHO, and Pan Americas, and Asian countries are coming together. But these are still fragile, as our title says. So we need to strengthen this regional capacity to make it work. I'm not going to get into financing because I know Scott is going to talk about this. Suffice to say, we still have a long way to go in assuring financing. Pandemic fund was a very important step going forward, but not enough. We need sustainable funding for global public goods. So thank you, Sylvie, for asking me to speak.
Thank you very much, Victor. Indeed, I mean, you highlight a very important point, I think, because in fact, research and development and R&D, as we say, during emergencies or for emergencies is very recent. The R&D blueprint developed by WHO only was developed after Ebola, when we realized that to tackle epidemics of this 21st century, we often have no vaccine, no treatment, no diagnostics. And so we need really for the future to not respond to epidemics and pandemic as we did in the 20th century, just using public health and social measures, for instance, and quarantine and cordon sanitaire and those kind of things, but really start embarking in pushing for progress in medicine for those emerging diseases. So I think it's very important also to ensure that the research we do during emergency provide first rapid results. As you said, speed is very important, but also making sure that it's quality product, safe product, that we are not harming anybody by using those products, and of course that there is a distributed capacity to produce, because this is how we can also not only ensure speed but also ensure equity. And so I think it's really important that you have highlighted this. And I really like also the fact that you are mentioning, for instance, the 100-day mission. Of course, it's probably an inspirational targets, because it's very challenging to develop any new product in 100 days. But I think this is what we need as well. We need challenging targets if we want to push really the progress in medicine, and really find new treatment, new vaccine, new ways of dealing with those emerging diseases. And I recall that for HIV, it was the case. I mean, after HIV, there was a lot of research that was supported, and they finally discovered antivirals. And I think it has revolutionized as well the way we look at viral diseases, because before, viral disease were considered that either untreatable or as minor disease, and that doesn't deserve necessarily a huge amount of research. So I think those epidemics can also help us to embark for a new ways of looking at the future, and also making this world safer, obviously. So thanks a lot for all those very important comments. And I would like now to give the floor to Scott Pendergast. Scott, you have seen that the GPMB report highlight the necessity to reform the global financing system for pandemic preparedness. A pandemic fund has been recently created to identify, to address the identified $10 billion gap per year. So can you provide more insight into this pandemic fund? Why was it created, and how can this instrument make a difference for the future? Thank you, Scott.
Thanks so much, Sylvie, and thanks to the panelists before me. So, as you said, Sylvie, the GPMB report has really highlighted once again that despite all the work that we've done under COVID, we're still not prepared for the next pandemic. And we're also seeing, beyond just pandemics and epidemics and outbreaks, increasing health emergencies from both climate and geopolitical related crises. So overall, we're sort of seeing an increasing need to be able to be better prepared and ready and resilient to health emergencies. And that need is across a broad spectrum of areas, you know, from some of the points that have been mentioned around access to countermeasures, but improving surveillance and laboratories, to working with communities, and I saw this in a comment, you know, to better understand what their specific needs are, what they're hearing in terms of information, disinformation, working to protect communities through vaccination, preventing spillover events, vector control, public health and social measures, but also within the health system to be able to rapidly scale care during emergencies and make sure that the essential services aren't disrupted during emergencies. And this all needs to be brought together with strengthened emergency coordination across all levels of our societies. So there's a broad range of investments that need to be made in multiple sectors. We did a piece of work with the Joint Finance and Health Task Force of the G20 together with the World Bank, where there was an estimate of around about 30 billion per year needed for investing in preparedness. And as Sylvie said, around about approximately a $10 billion gap. So part of this was to try and establish a sustainable, additional long-term dedicated financing stream to cover some of these issues. And that's really why the pandemic fund was created, to have this additional long-term financing stream. To date, the pandemic fund has got about 25 donors and about $2 billion in pledges. And the idea is that it complements the existing institutions and financing and not replacing them in the pandemic preparedness space. The focus of the pandemic fund is, as Victor said, that big gap in particular in lower income countries and lower middle income countries around national capacity building, but also in terms of some of these regional and global public goods where we need to invest to make sure that all countries are better protected. The pandemic fund has been established. It's got a secretariat, which is housed within the World Bank. WHO is part of the secretariat. There's a board that's overseeing the work of the pandemic fund, which is made up of both contributing countries as well as beneficiary countries. So it's an even split of 9 and 9 seats with 2 seats for civil society organizations. So it's a very balanced board. And it works together with countries through existing implementing entities such as WHO and the World Bank and UNICEF and CEPI, Gavi, Global Fund, and other multilateral development banks that are working with countries and partners to propose projects that are then reviewed by a technical advisory panel, so an independent technical advisory panel, and then the board is making decisions on the actual prioritization of funding. So far, there's been the first call for proposals, which was done last year. The initial priorities were in the area of surveillance, laboratories, human resource, and workforce strengthening, very much taking a One Health approach. So working together very closely with FAO and other agencies around that animal-human interface in particular. And in the first call for proposals, we worked with countries to leverage their existing assessments and plans to really identify some of the critical gaps in those areas in a coordinated way across these different implementing entities. And for the first round, I think there was 2.1 billion of proposals made. What was very impressive was this was made from 92% of eligible lower income countries and 80% of eligible low middle income countries all made proposals. So it was a very broad coverage. The technical advisory panel reviewed those proposals and recommended or highly recommended over $1 billion of investments. And in the first round of funding allocation, the board approved 19 selected projects totaling about 340 million. So currently, those projects are underway in those 19 projects. They're being set up with the government, with the partners, and hopefully we'll be able to start reporting on results in terms of capacity building and improvements in those areas. And I think this is where the GPMB in particular also plays a critical role, is as we invest in these critical gaps, we also have to be measuring to make sure that those investments are actually resulting in increased capacities in the areas that we've identified. So we'll continue to work very closely with GPMB and other monitoring methods such as the IHR reporting to make sure that we can try to demonstrate impact improvements as a result of these investments. However, as Victor said, the pandemic fund alone won't get there. It can help to catalyze, it can help to fill critical gaps, but really what we need to see is increasing domestic investment, in particular in preparedness in all countries. We also need to see better alignment of existing investments in health and other multi-sectoral areas, in particular in vertical programs, so as that we're getting more value for preparedness out of our existing programs. And polio, for example, would be a critical program as an example of where I think we can leverage across some of the investments that are already made to get better general preparedness. And then additionally to this, we will still need to raise additional financing to fill those gaps. So at the moment, the pandemic fund capitalized at 2 billion is a very, very good start. But really that target of 10 billion per year is really well outside that kind of a range that we're in now. So we're working together with the bilateral partners, as well as the multilateral development banks, in particular the World Bank, to see how we can get increased sustainable financing across all of those different areas that are required for preparedness. Thanks, Sylvie.
Thank you very much. Sorry. Thank you very much, Scott. I think this is really first-hand information on those new facilities to support preparedness and investment in preparedness. As you rightly mentioned, I mean, without money, it's very hard to get better prepared because most of these improvements require funding and really long-term investment. This is where preparedness is like development. Somehow we need to have this long-term approach and making sure that the essential capabilities are built beforehand, so that we are better prepared and ready to respond. So I think it's great to see that international organizations and especially the World Bank are getting committed to find new ways of financing preparedness and response. And there are a few questions in the chat. So if we have time, I think we will come back to you to ask you a little bit more about, for example, conditionalities and how we can make sure that those new facilities can really achieve what they are meant for. I will just see, because we still have some time, I would like to go back to Joy. And because we see also in the chat that some people are really asking about the issue of the other sectors, and because we have all observed that the pandemic has impacted all sectors and not just the health sector. And so understanding that preparedness is a multi-sectoral effort, this makes sense, really. And so in the GPMB report, you advocate for multi-stakeholder and multi-sectoral engagement in pandemic prevention, preparedness and response, and finding new ways of achieving this multi-sectoral engagement. So not only in the financing aspect, as Scott mentioned, but also in other aspects of preparedness. So for instance, in One Health and addressing the risk of emerging pathogen as a human, animal, environmental interface. So Joy, can you tell us why it is necessary to make this call if it's so obvious that multi-sectoral engagement is the way forward?
Thank you so much. This is a very important question, and I would like to also say it is very much in line with a question comment in the chat group by Bakisa Bashir. I apologize if I've mispronounced your name, where you talked about indigenous groups, the marginalized communities, where there's no infrastructure. It really makes it very, very important for us to appreciate that pandemics, they are actually caused by not just human health matters and animal health matters, in the environmental, the socioeconomic factors. These are some of the socioeconomic factors you are talking about, whether it is land use, whether it is the places where people live and how they interact with that environment. So responding to pandemics means that we have to have services, facilities, capabilities where human beings are. So it involves coordinating supply chains from those communities, the marginalized, the women in the rural areas, the mobile population, addressing trade barriers, including ensuring that we are implementing social protection measures that are going to address these populations, and making sure that our education systems are actively engaged, and that we appreciate that economic growth comes from these communities. So it is a geopolitical issue. We cannot expect economic growth for so long as we marginalize, we exclude, and there's lack of equity. So many different actors and sectors need to be mobilized quickly and effectively. This requires for us to be able to develop ways as communities, as governments, as stakeholders, to oversee, to coordinate between the various elements of the response and make sure that we adequately engage everybody in every sector: health, education, trade, supply chains, rural communities, and appreciate, the lessons that we learned from COVID, and appreciate that each sector has got its own responsibilities. And once you have export bans, trade barriers, travel restrictions, border closures, as a measure, without actually putting it in the context of the response and appreciating the equity issues, and also addressing the role of each sector, we have to understand the holistic health and socioeconomic impacts and outcomes before we take action. So we cannot rely on ad hoc mechanisms. And we must appreciate that at the start of a health emergency, we must be ready to respond. Going back to what the 100-day mission agenda, important holiday reading for everybody. Kate Kelland has actually published a book, and it is talking about the 100-day mission. It's called Disease X, the 100-day mission to end pandemics. Read that book. It's very, very well written. But it sort of gives you an understanding of how we are going to link all these together. Currently, we have no mechanism to systematically engage the different stakeholders and the actors in preparedness. While there is some, coordination across multisectoral institutions, as we know, like on One Health, most preparedness efforts at the national and global levels are still being done in silos. So there is no clear process to involve the private sector, civil societies, and like, people are saying, to engage the communities, and to engage the marginalized. And we have to make sure that this is in place. So our fourth recommendation in our report is to develop a new approach to multi-sectoral, multi-stakeholder engagement, because we see this as very, very important for pandemic prevention, preparedness, and response. So this new approach is needed to bring together all stakeholders, but to also make sure that we are building across, all levels of society, and making sure that preparedness really speaks to the woman, the child, the handicapped old person on the ground, and that it's more integrated, there's a coherent response, and we are able to deal with future emergencies effectively. Thank you.
Sylvia, may I respond?
Yes.
And say how much I agree with Joy. She is so right. I said that, even I talk about science innovation, because these innovations are useless if you don't get to the people who need them. So that's why the issue of equity is so important. And I think Joy emphasized how important it is to have everybody work in the same direction. None of this can happen if one sector or the other work, but they all have to work the same direction. To me, an important issue is trust and community. I think in our three major areas, we talk about coherence, the importance for everybody to be working coherently and to have trust in the community. I see one of the chat, for example, Bashir said, a place where there's no hospital, no clean water, no food, no education, and disease and awareness. So as you can imagine, this is where we're dealing with. So I don't want to be looking like a scientist just sitting there doing research, innovation. We have to understand that we're doing it for the people, and everything has to get to the people. So the last mile of delivery and society and community is so important. So I totally agree with Joy. It takes everybody to work, but if it doesn't get to the people who need them, then there's no point doing all this stuff. So it's important to look at community trust.
Yeah.
It's important to have delivery systems. It's important to understand that the medicine, diagnostics, and vaccine get to the people they need it. Thank you, Joy.
Yeah, and thank you, Victor, for highlighting also these issues. I think what you have said, and Joy and yourself, it's really first, what is really new is that we want really a holistic approach to preparedness, and it's not only the problem of the health sector. Everybody needs to contribute to preparedness as well. And as you rightly said, it's not something, collaboration is not something you can build during a crisis easily. It has to be built before, it has to be systematic, it has to be embedded in the functioning of governments and institutions, so that it's really effective when we have a crisis. And especially if we want it to be inclusive, because usually the marginalized community remains marginalized during crisis as well, and even more marginalized. So if we want this to change, we need to work and make effort before crisis. And I think this is the sense of the recommendation of the GPMB is really let's work together and let's make the effort together before the next crisis. So I think it's so important what you said. And I would like to also emphasize what you have mentioned, Joy, is that really preparedness, it's aligned with development and prosperity. it's seen by many people as an investment, just a protection and a shield, but also it's a way to build prosperity for the future. So thanks a lot really for your very wise words, and this gives us more food for thought. So I think we may have time to have some question from the floor, and I'm just looking at my screen to see if we can pick on one question. And I think there was question. So about collaboration, we have had some, and maybe Joy, if you can give us your feedback on. There is a question on what strategies does the GPMB propose to encourage and ensure sustainable political commitment on a global scale, as highlighted in the GPMB report? So can you give us some feedback on this question that was somewhere in the chat? We have many questions today, so it's one of them. Sorry if I cannot give the name of the person who asked the question.
Okay, no, thank you very much for this. This is an important question because when we talk about leadership, we are really talking, it starts with the political leadership. And one of our focuses all of this year until September was focusing on the outcome of the declaration that will be coming out of the September UNGA summit, because we had hoped that declaration would actually reinforce the role of leadership by ensuring that making it a requirement that the legal instrument that comes out of WHO be extremely strong and have some binding elements. But that will ensure, for example, that there is equity, there's coherence, there's monitoring and accountability, and that we actually are able to bridge the humongous financing gap that we currently have in pandemic funding, pandemic prevention, preparedness, and response. I think you've already seen our take on that declaration, that we felt that unfortunately it was weak in the areas that we had hoped it would be strong enough to actually influence the development of the pandemic agreement that is going to the World Health Assembly in May. So we are now looking to the ministers of health as the next level of leaders to actually deliver a strong instrument at the World Health Assembly. But I want to underscore here that leadership is not just about the political leadership. That leadership is about the private sector. It is about civil society. It is about communities. It is about academia, research institutions. It is about every single stakeholder who has the ability to influence the response to a pandemic and the preparedness. So this leadership, wherever it sits, must be robust, and it must be informed by science, by evidence, and it must be focused on effectiveness of this response.
Yeah. Thank you very much, Joy. Maybe another question, because we see a lot of comments in the chat and the question about how difficult it is to collaborate between different agencies and put in place this cross-cutting collaboration. So maybe to you, Victor, because you were part of the Act A partnership, as you mentioned earlier in your responses, and so can you tell us from your experience what is the value of such partnerships during crisis, and what challenges did you encounter, and maybe you have suggestions to improve those kind of partnership in future pandemics?
Thank you very much. I think partnership is absolutely important. Partnership among agencies and partnership across public and private sectors. I think we wouldn't be where we are today, even though it's not perfect. It's a significant advancement, without these partnerships. As you mentioned, ACT-A, it was founded in April 2020, in the time of course, pandemic, the beginning of pandemic. As we look at this, we have UNICEF, we have the Global Fund, we have Gavi, we have CEPI, we have all these organizations, but they've all worked separately. And sometimes they work vertically in their own space. But pandemic requires everybody to come together. And of course, as we mentioned, Preparedness now requires everybody to continue to work together. So this was a very voluntary, informal group of many, like 10 UN agencies and global health organizations, certainly WHO, but as I mentioned, CEPI, Gavi, FINE, UNITAID, UNICEF, World Bank, Global Fund, and others, to say we must try to work together in a coordinated fashion. It's an informal group that came together quickly to focus on the entire end-to-end, from research development all the way to delivery and procurement, and of course, working along with regulatory agencies for pre-qualification. So this is I would say, even though it's not perfect, it's an example of how partnerships can work, because what we did as a group together is to continue to look at the same populations that we all provide support to, but the populations, of course, low-income countries and everybody else, but asking the question, do we have enough therapeutics? Do we have enough vaccines? Do we have enough oxygen, PPE, et cetera, et cetera? So, ACT-A, which is now in transition, because now the pandemic emergency is over, has done a lot. It has, for example, 2 billion doses of vaccines delivered, about 182 million diagnostics to the 182 million countries, and many therapeutics, oxygen, and PPE. And so what we did is meet on a regular basis to coordinate and to discuss the issue. This was led by WHO as the host and the hub, and altogether raised $23 billion. Of course, it's still not enough, as you heard from Scott, and most of it went to vaccine. So we need a lot more for the other areas as well. So as ACT-A is kind of sunsetting, we had a chance to go back and look at what our lessons learned, right? First, as I said, we should celebrate that people come together as a coalition to work together. But it's a very informal method of coordination. There's not enough accountability, as our GPMB report says. We need accountability. There's limited engagement, as I said earlier, with low and middle income countries. And there's not enough focus on the delivery side, which everybody said is so important. So we have a lot to learn. We also have a lot to learn how to raise money together. The ACT-A still, each sector raises its own money separately. Vaccine got a lot more than others. So strategic coordination of how to prioritize areas, both of work and also of fundraising, is really important. I think the big concern we have is the thing called Health Systems Connector, which is on the ground, oxygen, PPE. This is very difficult to deliver and raise money, and of course, manufacturing. So ACT-A was a success, in quote. It's not perfect, but it was good because it did a good job while it lasted, not perfect. But now we need to replace it with something, as been said by everybody, during peacetime, that creates that kind of multilateral, multi-sectoral coordination, preparedness. So the next time when that happens, everybody's ready.
Yeah. Thank you very much, Victor, Joy, Scott, for those fantastic comments, and it really highlights how important, deep, profound and innovative is this report, and how it can guide the world to better preparedness. Of course, as you highlight in the chat, there are many topics that we couldn't really address today, and I hope that Supriya will give us more space in the EPI-WIN sequence, so that we can maybe invite other members of the GPMB to talk about other areas of work of this very important board, and such as, for example, trust, information, One Health, community engagement, and so on. But really, thank you very much to the speakers and to the audience for the fantastic questions. We have not been able to answer all of them, of course, today, but we keep them, and we hope we can in the near future give you more answers and more detailed information on those topics. So thank you also to the GPMB Secretariat team for working behind the scene and looking at the question. Thank you for the EPI-WIN team as well. And Supriya, I give back the floor to you for the closing remarks. Thank you.
Thank you very much, Sylvie. And of course, I mean, for such enriching discussion. Wow, I mean, there's always space in EPI-WIN for such discussion. So thank you very much. Thanks to you, Sylvie, for well, bringing this to EPI-WIN, first of all, and for such great moderation. Thanks to all the speakers. Each and every one was fantastic. And I'm sure when we go back to the video, because this is recorded and is on YouTube in 9 languages, and will also be on the website. And when we go through it, I'm sure we'll find many, many gems in future as well, which will be very useful. I hope all the participants found it as enriching and useful. I'd like to thank also on behalf of EPI-WIN all the speakers and the GPMB team who's been working in the background, Tim, Shoya, Elizabeth. I hope I've pronounced the names correctly. And the EPI-WIN team who's brought this together, Agnesi, who's worked very hard to coordinate with everyone. Priya Umachandran, who's been speaking to all of you on the chats, as you know, Gabriela Santeso, who's been working in the background, and Jiangfang Liu, who's always been a great support to us. And thanks also to our unit head, Tim Nguyen, who leads this work. So thank you very much. Just to let you know, we've shared a link to WhatsApp group. So if you wish to continue to talk to each other and discuss this further amongst the participants, you're welcome to do so. The recording, as I said, will be on our website in 9 languages, also on YouTube in 9 languages. So please do join it and share further. And please subscribe and share the subscription link with all your networks and contacts for more EPI-WIN webinars. And thank you, and have a great afternoon or morning or evening, wherever you are. It's always wonderful to have you with us. Thank you. Bye.